I rise to make what I consider to be a small contribution in support of the second reading of the bill shortly entitled Covid-19 Prevention and Control Bill 2020. Essentially, we would have had the benefit of an explanation of the various parts of the bill by the Honorable Mover, the Attorney General, who would have cited quite succinctly that the bill would have been constituted of 5 parts and some 8 schedules, the last 2 of which would have been withdrawn and replaced by new versions which would have been distributed by the clerk earlier today. Essentially, what has been provided for in this draft legislation is a set of protocols that would have been used in the past, refined for the future, and at the same time been done as a means of addressing what has become a very costly, pervasive, disruptive pandemic, the likes of which have not been seen prior to 100 years before, when none of us would have been alive. As would have been noted by the Honorable Attorney General, Mr. Speaker, as he opened the debate, the bill lays out the administrative and leadership roles of the Chief Medical Officer, the National COVID Task Force, who have been charged with the management of the crisis from the very first indication that we would have imported 2 cases of COVID-19 in the Federation on March 25th, 2020. As the former Minister of Health, I would have had the unfortunate task of reporting to the country that afternoon that we had had our first 2 cases. And I know that across the length and breadth of the Federation, it sucked the collective air out of all of our lungs when we had to come front and center with the fact that we had now joined a cadre of nations that had become susceptible to the novel coronavirus. Be that as it may, it would be remiss of me if I did not at this juncture pause to congratulate all of the individuals who would have been instrumental in getting us past these 7 months with just 19 cases, 0 deaths, and virtually no serious hospitalizations or illnesses related to COVID-19. These individuals would have been led ably by the Chief Medical Officer, Dr. Hazel Laws, the National Disaster Coordinator and Chair of the COVID Task Force, Mr. Abdias Samuel, and also Dr. Cameron Wilkinson, the Medical Chief of Staff of Joseph N. France General Hospital. Their leadership, their selflessness, their sacrificial guidance, their love of country was evident in the long hours, the advice, the spur of the moment arrival at meetings that were important, and their leadership of the task force by extension. We at the same time would have to give due credit to the security forces of our country, our frontline workers, immigration, customs, CASPA, NEMA, the St. Kitts Tourism Authority, who were all part and parcel of the thrust towards getting the COVID-19 pandemic under control. At the same time, we also thank those workers, the compliance officers, who would have labored continuously in terms of making sure that the non-pharmaceutical protocols that are in place to this point to save lives, since there is still no vaccine, regardless of what AstraZeneca, Moderna, and others would have touted as their 95% or 90% efficacy in terms of getting close to a vaccine that should deal with the pandemic. But in the interim, these are the people we must rely on. And while we continue within the context of the state of emergency, we still would require their services and their selflessness when it comes to their own personal time and families that would have been sidelined in the interest of national development and again, out of love of country. Mr. Speaker, the bill, for the most part, would have gone the distance in articulating the requisite protocols that should obtain and continue to obtain in terms of controlling the spread of COVID-19, from the personal level to the national level, insofar as the way in which we should really govern ourselves by adapting in the exercise of our daily lives. When we look at it, we have been affected not just at the personal level, but also in terms of education, spiritual, social, entertainment, leisure, travel and tourism, and the list goes on. Mechanisms for the detection of COVID-19 are also outlined in this draft bill, inclusive of testing and screening, etc., so that we can continue to grab and hold a handle on the gains that we have made thus far in protecting the people of St. Kitts and Nevis. Some of these restrictions that are now being looked at in terms of the new bill would include the app, the XMAP app, which has already been explained by the Honourable Mover of the bill, and of course reiterated by the Honourable Member for Number 3 and Minister of Health, as a means of tracking persons who enter the Federation under quarantine, for whose whereabouts and movements we would have to be sure of, so that in the event that there is any positive testing, at least it would make the business of contact tracing a lot easier. Mr. Speaker, it is not my intention to belabor the point about explaining the contents of the bill. Those are well established already. The mover of the bill spent quite a bit of time going through that in terms of dealing with those protocols that are now enshrined as articles in the bill, as well as the sum total of the 8 schedules that would give effect to the bill that is under consideration. We also recognize, however, that as the Honourable Attorney General would have done in the discussion of Schedule 7 and 8, and which unfortunately it appeared that the Honourable Member for Number 1 did not have time to review, because unfortunately his comments about members being in and out of a bubble obviously indicated to me that he was still reliant in his prepared text on the notations that would have been enshrined in the previous iterations on the Caribbean bubble, which for all intents and purposes has no place in the current amended draft legislation that is currently before us. Everyone in this room and the general public would recognize by now that the CARICOM bubble is something that St. Kitts and Nevis would have gotten out of several weeks ago, once it was evident that countries like St. Lucia, Antigua and Barbuda, as well as Barbados, would have been experiencing community spread. And of course, the previous iteration of the schedule would have made mention, and I quote, of the fact that please note that the situation in these territories will be monitored continuously by member states, and member states will be removed from this list if community transmission of COVID is reported. Of course, within the context of removal, it supposes that there is action being taken at the CARICOM level through consultation that would result in that removal. The position taken by us in terms of exiting the bubble is that while we could not unilaterally as a country remove anyone from the bubble, we could do what was within our power to do, which is to remove ourselves from the bubble. And that is precisely what we have done here. I should also indicate, Mr. Speaker, that the whole issue of the CARICOM bubble is not something that the government is saying that we will never ever contemplate in the future. It is something that might still be considered at a later point, but we will cross that bridge when we come to it. And in the meantime, we would make the unequivocal message that the priority for us here in St. Kitts is the health and safety of our people, regardless of what others might deem as their own rhetoric, which, if they repeat it enough times, perhaps becomes a reality and the truth, which the rest of us may not subscribe to. We would have had an abundance of media coverage, Mr. Speaker, over the past 7 months in terms of the statistics that are emerging on COVID-19. Much of these statistics we would have taken from authoritative sources such as the World Health Organization, COSAD, CARPHA, to be more regional. And essentially, what we are now seeing is that COVID-19 has wreaked havoc on the global economy, has resulted in some 1.33 million deaths, 55.2 million infections, and 35.5 recoveries have been attained to date. And that is as of this morning, based on the data that I have in front of me. In short, the pandemic has disrupted all of our lives in an unprecedented manner. By extension, the virus, if truth be told, will be with us for a very long time. And while this piece of legislation seeks to put into context the the protocols and the safeguards which should guide the way in which we govern ourselves and the way in which we interact with persons at work, at leisure, etc., we will still recognize the fact that just like the virus, any piece of legislation is dynamic, meaning that once we are following a pandemic whose epidemiology continues to change, in like manner, it stands to reason that we would make the necessary adjustment, both regulatory and legislatively, when necessary. St. Kitts and Nevis would have been dealt a very hard blow as the tiniest nation in the Western Hemisphere as an independent state. And the closure of our borders would have created much contention among some. At the same time, we would have recognized that there were fall-off in revenues, especially when one acknowledges that the bulk of our GDP comes from tourism and the allied services sectors. At the same time, in response to that pandemic, the government would have done an unmatched injection of funding to the stimulus packages in terms of supporting the economies and the livelihoods of people most affected. While I'm on my feet, I should indicate that inasmuch as we would have had a stimulus package, which initially was $120 million, by the constant additions and responses that would have been built out, the current stimulus figure is closer to $150 million, and that is not inclusive of the extra budgetary amounts that are being paid out and calculated in terms of the severance payment fund, which this government would have inherited as an under-resourced, under-capitalized fund that had been even more taxed by the creation of a long-service gratuity program by the previous administration, which created even more undue burden on the severance payment fund without putting in any new capitalization in such. And for the benefit of the public, the long-service gratuity is only a benefit to persons who are in the tourism sector or in the manufacturing sector, thereby paying them a sort of gratuity for at least 10 years of service in any one establishment's employ. I should state at this point that in light of the lapses that we would have seen, brought front and center and magnified by the pandemic, the government is actively looking at the amendments to the Protection of Employment Act, which would be inclusive of amendments to the Severance Payment Fund to deal with some of these weaknesses, the loopholes that exist. Presently, as it is, somebody could work for 3 different employers for a minimum of 10 years and collect long service gratuity from all 3 employers. Of course, you add that to the fact that the same pot of funds that this money is expected to come from is a severance payment fund started in 1986 and which to date only accounts for 1% of payroll payable only by the employer and nothing coming from the employed person. So it is obvious that sooner rather than later, there would have to be the requisite revisions to this particular matter because in its present formulation, the severance payment fund is unsustainable. To date, the Department of Labor would have paid out in excess of $11 million additionally to pay claims for COVID-19 for severance that would not have been contemplated and for a fund that was bankrupt. So we need to add that whenever we begin to calculate the inputs of the government in terms of cushioning the blows created by COVID-19. As I noted earlier, Mr. Speaker, we have found ourselves in a situation that we can be proud of in terms of having only 19 cases, 0 deaths, 0 serious infections. And yes, we are not alone. We would not have done this alone because, of course, as I mentioned earlier, we had a lot of help, a lot of support for doing so. We would have employed what we consider to be an all-of-society approach in dealing with the response to COVID. And it is as a result of that all-of-society approach, which would have been the rationale behind the composition of the task force that would have let us know that there were resources and skill sets and knowledge and intellect that resided across the length and breadth of the public sector, etc., and the consultative support of civil society that would have enabled us to get to where we are right now. There are some who say, why don't we go ahead and get rid of the state of emergency today? The previous speaker actually said that. They would have cited time and again throughout today's presentation quotations from the Honorable Member for Number 7, who ironically is yet to speak on the bill based on previous comments that he would have made outside of the environs of today's setting, which may or may not be germane to the rules of the House, but that is a matter that has already passed. But I would like us to remember that what is happening to St. Kitts and Nevis is no different to what is happening to other people elsewhere as it relates to responsiveness that is required. We have been told time and time again by the health officials, wash your hands, sanitize your hands, practice social and physical distancing. And for the record, both of those terms are in the legislation, not just social distancing, as had been construed by a previous speaker. And we have been told that we need to employ these non-pharmaceutical measures because obviously we are still a way off from a vaccine. Up to this morning, AstraZeneca, as well as I think it was Moderna, would have posited that their vaccine trials have resulted in some 90 to 95% efficacy. At the same time, we are looking at a situation that is developing in Europe where a new strain of SARS-CoV-19 has been found in certain mink populations, which has a different type of makeup, a different type of genetic makeup, which is telling us that even as millions of dollars would have been poured into research and development, for the development of this vaccine, it would not address that new strain that has now become evident as of last week. And that is something to think about. We can look at other jurisdictions, such as Sweden, for example, who was seen as the pearl of Europe in terms of its approach to COVID-19. No lockdowns, mask wearing if you want to, no gatherings of more than 50 people. And then I took my own ears this morning and heard the head of government for Sweden announce that, I'm sorry, that was the wrong thing to have done. What we will now have would be restrictions where, yes, you have to wear a mask, and no matter what the gathering, it cannot be greater than a list of 8. Similarly, we would have almost been to the point of chastisement after St. Lucia would have opened up on the 2nd of July of this year, and we were being told, look at St. Lucia. It is a best practice in terms of how to come out of a pandemic, how to deal with a state of emergency. And even while we were hearing these things, we would have had our own ears to the ground and would have known even before public utterances would have been made that St. Lucia, up until that time, had undocumented, or should I say unannounced, some 25 cases of COVID-19 that was not being reported officially. And the fact that they are now in community spread and well over 100 cases tells us that you cannot just look at what is being put out in the media. You have to do the research for yourself. And what applies for one jurisdiction should not be the basis of putting another jurisdiction under pressure. At the end of the day, Mr. Speaker, I contend that it is this government's preference that even though we are in a state of emergency and there are protocols which might seem to restrict freedoms and personal liberties, the government would prefer to err on the side of caution and have these measures in place for the good of persons who may or may not realize how risky certain behaviors may be. Some will say, we are COVID-free, why keep a state of emergency open? But at the same time, citizens of this country were consistently free to repatriate to their home country. And they were coming from a lot of the countries that were hotbeds for infection. So in as much as we were saying guardedly, tongue-in-cheek, we have no new cases, at the same time, people were coming in with their PCR tests, and then they would be tested again before they could leave quarantine at the end of 14 days. And there was nothing stopping during that time frame the likelihood of a previously negative tested person testing positive after 14 days. So how could we foolishly and childishly make the assumption there are no cases of COVID-19, let's just throw everything up in the air because all is fine? If all things were equal and the borders were still genuinely closed, but at the same time we were preventing citizens who have a right to return from coming here, then you could say that, because all will remain equal. But at the same time, we were consistently, through the emergency powers, making allowances for persons to exercise their rights to repatriate to their home country. from countries, I might add, that had escalating numbers of COVID-19. So I say all of this to say this, Mr. Speaker, that the government is unapologetic in terms of the measures that we have taken thus far to protect lives and to control the spread of infection. While I'm on my feet, Mr. Speaker, and just to give us a clue as to how this whole issue about non-pharmaceutical measures can be taken out of context, taken for granted, and then those of us who choose to wear a mask are wearing it to protect ourselves and other persons, but those who do not wear a mask are not protecting themselves and other persons. Just yesterday, on one of the news channels coming out of New York, there was a video that has now gone viral, filmed by a child, he's a grown man now, of two citizens of St. Kitts and Nevis, Joseph Buchanan of Sandy Point and Glenn Glassford, if I am correct with his name, from Birkby. And their son, Jaden Glassford, who happens to be working in media in New York, was on the spot just in time to capture where a worker in the Staten Island station is standing there giving out for free COVID-19 preventative PPE, a mask, to everybody who is coming into the station. And the camera was just in time to catch another person who had just used the station, put up his hand to block the receipt of the mask. That too is an example. And that picture, as I said, has now gone viral, that in spite of the best efforts of state agencies and also organizations and institutions that govern mass transit, as in this case with the Staten Island station, people at the end of the day, if they refuse to wear a mask, what are you going to do? You can't beat them into wearing a mask, but if you can have a legislative measure that encourages them and basically puts the fear of God in them that you need to wear a mask, then if it does the thing that it is meant to achieve, which is to control infection, even if you're either naive or too ignorant to realize the value of wearing a mask, then this government is going to encourage that, because we want everybody to be safe, those who are COVID savvy and those who are COVID ignorant. So that is the point I would want to make on that particular matter. Now, Mr. Speaker, one of the things that we have also noticed is that as we come into a state of relaxation, where we have had virtually no cases within, I would say, more than 30 days, etc., and we are seeing in the community a sense of laxity. We are seeing it at the Strip. We are seeing it on 4th Street, Church Street, wherever you go. And while I'm here on my feet, I should give kudos to the churches, because they have set an excellent example of following the protocols to the letter. And there is much to be learned from that example. And as a result, what we are seeing is that there are persons out there who think that because we have no cases, as I noted before, you don't need to wear masks, you could huddle together if you want to, it doesn't matter. You could embrace all you want and do other things, because at the end of the day, how dare you infringe on my human rights, my civil liberties? But then, yes, we're in a closed economy, and some say the economy has been closed for too long. Open up everything. We are preferring to open up in a cautious manner, and hence the reason for these protocols to be put in place. And if we are going to think that it is our time to sit down and assume that we rest on the laurels and nothing else is going to happen, we had better think again, because we opened our borders on the 31st of October. The Honorable Member for Number 4 was very careful in his discussion, his iteration of the flights that have come in, those that are still suspended, one in particular, BA, for the very reason that the UK is now in the throes of its second wave of the virus. And we still have to recognize that while it is true we are tourism dependent and we are airlift dependent, especially from jurisdictions and source markets that are having high cases of COVID-19, we still have to protect the gains that we have here. Now, I would also like to point to the fact, Mr. Speaker, that in focusing on the fact that we need to protect the gains, we need to remind in a very sobering manner the people of St. Kitts and Nevis of the fact that in as much as some 18 million would have been injected into the health system, the infrastructure of this country to prepare for COVID-19, to the point where we can boast and we can say we have over 30 ventilators and we have perhaps maybe 40 rooms available that could deal with seriously ill people. That's only 40 rooms. The population is at least 50,000. So what are we going to do? Draw lots for who gets the bed? Are we going to have a lottery to determine who gets cared for? Or are we then going to be looking down the barrel of some of the images that are burned in our brains from April onward, when you would have seen epicenters like New York have body bags lined up in the corridors of hospitals because there was no space left in the mortuary to hold them? Or other images in terms of mass burials, because of the point that you've gotten to the point where your mortuary system is so overrun that you have to have a mass grave with markers to put all of these persons in. And later on, if their family is so cared to, they can get exhumation orders to give them the type of burial that allows them to have a proper goodbye to their relatives, who most of the times could not have even been by their side to hold their hand because of how infectious the environment would have been. So these are just some things that I would want us to think about, because it does not mean by any stretch of the imagination that we are out of the woods. We are a small economy, but we have a responsibility as a member of the international community to do everything in our power to protect the gains that we have had, and at the same time to prevent as far as possible the continued spread of COVID-19, and heaven forbid also to prevent any deaths from occurring, at least in our jurisdiction. COVID-19, Mr. Speaker, has shown us that it transcends all boundaries. COVID-19 transcends politics. It doesn't care who you are, which color shirt you wear, who you voted for, your age, your gender, where you live, who you work for, the type of job that you have. We have seen in the news evidence that suggests to us categorically that persons affected by COVID-19 are commoners, prime ministers, and presidents. In one case, one particular prime minister would be very lucky if he does not have to go through a second round of COVID-19. But he is now isolating. And these are some very real issues for us, as we would have heard our neighbor, Alan Chastanet, the Prime Minister of St. Lucia, now that it has hit them, that they're in the middle of community spread, how very infectious COVID-19 really is. It is not a joke. And we cannot assume that we have the right to do as we feel because we figure our civil rights are eroded or things are too punitive and the like. At the end of the day, as a government, we have a responsibility to care for the people of this country, and whoever may wish to thwart that or warp it in the process, that is your issue to deal with. But at the end of the day, we would not want to be on the wrong side of history by taking things in a very lax manner and not doing everything in our power to protect our people. The time will come when we will reach to the end of the state of emergency. But I promise you that when that happens, COVID-19 will still be with us. But what we will have for guidance are these regulations, these schedules 1 to 8, and the COVID Act itself, which is here to guide us. We do not expect that this COVID bill is the answer, the panacea to everything, because we do not have all of the answers. And that brings me to a point made by a member opposite recently as to why is it we could not have come with this bill in April. Well, I would admit that while this government has a good track record in terms of managing the country for the last 5 years, none of us are clairvoyant. And none of us could have predicted that the iterations that are in this bill now, we would have had the know-how and the foresight then, 8 months ago, to put in place. But then I would challenge the member opposite to put their money where their mouth is. Because if I recall correctly, during the last couple of sit-ins, we hear the rhetoric in here about the willingness to work with government for the good of the people. If you are so all-knowing then that we should have had a bill which we should have passed in April instead of going to a state of emergency, why didn't you come? Come with a draft. Come with a point of discussion that we could all be on the same page and be further along right now. Just a question, Mr. Speaker. Mr. Speaker, there are one or two other matters I would want to tackle before I take my seat. And it has to do with the fact that The government is being accused here of, instead of bringing a bill, of bringing what can be best described as a compendium of protocols already gone before. All along, as we were going through this pandemic, we were carefully monitoring how other countries, including other CARICOM member states, would have been responding to COVID-19. We looked at St. Lucia, we looked at Jamaica, we looked at Barbados, we looked at Trinidad and Tobago. And then I had cause to go back and look at those countries again today. For example, when it comes to St. Lucia passed its COVID Act on the 2nd of October. The Act, for the most part, is structured in a very similar manner to ours, mostly protocols. In the case of Jamaica, they chose not to decide on having a separate COVID Act, and what was done instead was an amendment to the Disaster Risk Management Act by carving out a separate niche altogether for the management of COVID-19. In the case of Trinidad and Tobago, they did something similar. They did not come with a separate COVID Act, but what they did was to enhance the public health ordinance, and that was done in August of 2020. So that is an argument from where I sit that cannot hold water if you're really looking at what obtains regionally for guidance in terms of what could have been done. Now, there is another point before I take my leave that I would like to touch on, and it has to do with the issue of working from home. This government, as would have been the case with a number of other governments all over the world, would have gone to a system of a work from home option, especially for persons who are considered essential workers. For the most part, those persons who were in a more support or administrative type of environment were not compelled to come out of their homes. Persons who were in middle and upper management who could have stayed at home and worked from home did so, and did so effectively. The very Department of Labor had persons working from home, beginning to process claims that would have then become due and payable as of, I would say, June of 2020, bearing in mind that if you're to follow what the severance payment guidelines state, if you lay off somebody and 12 weeks later you do not offer them re-employment, it then means that you have triggered severance. So for purposes of this discussion, Marriott workers who would have been laid off and other hotel workers in March suddenly would have been in a situation come the end of June to be in a situation where they now become eligible for receiving severance, whether or not the employer follows up with another letter bringing an end to their employment, citing the impact of the pandemic on the tourism industry in which they were operating. Now, I have noted concerns coming from the member for number 1 and the honorable senator opposite about putting things in place so that people can work home properly through equipment and through PPE. Well, that one I find somewhat questionable, because I cannot for the life of me understand why the government would have to provide you with PPE if you're working from home. So I would assume that that was a slip of the tongue. In terms of the hours of work, of course, this is not a slave-driven economy. I think I heard mention about, are they really working only 8 hours, or are they being penalized further? And these are some of the things that I think really do not help the argument. And while it is true that depending on the nature of work from home that you are doing, you may require certain bits of equipment, that is not the case for the rank and file of every single member of the civil service. Quite the opposite, I found, when we consider that a well-known sub-regional organization that is headquartered here right in St. Kitts had the misfortune of going through similar mentalities by a number of their staff, where they're working from home, some of them are still working from home, and all of a sudden, because the managing director indicates that you'll get the opportunity to work from home, they don't have internet. So that sub-regional agency had to put in internet where they live. Then they don't have a laptop. The company then had to find a laptop for them. When that wasn't enough, oh, well, by the way, I'm working from my dining room table and the chair is not ergonomically suitable. So as a result of that, the company then had to find pneumatic wheeled chairs to be delivered to the homes of some of these persons. So I am hoping that member for number 1, that as you iterate some of these concerns and provisions that should be put in place for working from home, that you are not unintentionally advocating some of the practices that we are seeing emerging from that sub-regional institution, to which I refer and which shall remain nameless, but I think you and I know precisely what we are talking about right now. Mr. Speaker, in closing, I would like to state that it is the imperative and the intention of the government to continuously monitor the dynamics of the COVID-19 virus. To do otherwise will be irresponsible and foolhardy. We may have to come back to this Honorable House to make necessary adjustments, as the case might be. It's an evolving virus. The circumstances are ever-changing. We have to look at an environment very soon, assuming there's a vaccine that is ready, in terms of maybe making adjustments that would make some amount of relaxation necessary once there is sufficient vaccine coverage in the country that would negate the likelihood of having a continuity of some of the protocols. But until such time, we have to work in a sensible, measured manner. We have to continue to respect the sage advice of the medical experts who have guided us through this process in stellar fashion. And if it wasn't for their advice, we wouldn't be here where we are. At the same time, we are also mindful of criticisms coming of late in terms of the powers of the CMO. I would ask us to refer ourselves properly to the Public Health Act and to the Quarantine Act that state categorically what the powers of the CMO are. And to take us also, in closing, to page 18 of the bill, where it was referenced, for example, that the Chief Medical Officer may by order direct special measures to be taken. And then that statement was taken to mean that the Chief Medical Officer needs to have her wing clipped because she has too much powers and she has more powers than the Governor General. That is not what is written here. And if we even go to the very item under that, number 2, it says here clearly, an order made under subsection 1, the same problematic subsection, may be varied or rescinded by order of the minister. And for purposes of the bill, the minister is the Minister of Health. In light of that, Mr. Speaker, I have grave difficulty understanding how the powers of the CMO will be greater than the powers of the minister and the powers of the cabinet and the powers of the Governor General. On that note, Mr. Speaker, I rest.